Hello, my name is William Pearson. I am 76 years old and live in Hamilton, Ontario, Canada. I was born and raised in Nelson, British Columbia. Following school, I played hockey for 2 years, and after that worked in the steel manufacturing sector for 45 years. Following my retirement, I started up a consulting business. My consulting projects took me through different parts of Canada, Germany, and Poland. When I was in Krakow, Poland, our office was within walking distance from our hotel, and then arranged transportation at the office to go to different steel plants in the area. 1 week into the project, I started labor in my morning walks to the office. At this point, I found it difficult and started to do taxiing back and forth. Walking about the steel plants became more difficult. Climbing stairways up to operating decks, etc., became very difficult. I found myself having to stop about every 5 to 6 stairs before I continue. On my return to Canada, my first visit was to my family doctor, who ordered blood tests. She called me after receiving the results. My hemoglobin was 88, well below the normal range. She referred me to a hematologist. Thankfully, I wasn't going to a stranger, as I had seen that hematologist in the past, with other problems that I had. I find it more comfortable if you know the doctor you're about to see. The hematologist repeated the blood tests, and at the next visit, she ordered a bone marrow biopsy and aspiration. That was in January 2003. My hemoglobin at that time was 0.81. In a follow-up appointment 6 weeks later, she indicated that the results didn't look good. She wanted to repeat the bone marrow to get more information to compare. I still kid her that she bent the needle during the second bone marrow aspiration on purpose, but she maintained it with my bone structure being so hard, nothing to do with her. At this point, I started red blood cell transfusions to maintain my hemoglobin, and that was in March 19, 2003. On the next visit, she indicated the results of the 2 bone marrow procedures indicated a diagnosis of MDS. I don't remember any fear or concerns other than what's next. We discussed the option of a stem cell transplant. If that was to proceed, my sister would probably be the most suitable. I called my sister to discuss this with her. My sister Jane, she lives on the west coast of Canada. It's about a 5-hour plane ride. Her response was, "How soon do you want me there?" In other words, she was well versed in what had to be done. The bone marrow transplants take time to plan, and not all patients are able to have an allogenic bone marrow transplant. My age at the time, being 60 plus, was a factor, just outside the range for this type of transplant. So the doctor suggested a pill called Danisol, which might help my bone marrow function better. She indicated that based on her experiences, it was working in about 5% of her patients. After a period of time, the drug stopped working, and I was being transfused 2 units of blood at 2-week intervals between April 2007 and January 2008. I had developed iron overload as a result of all these transfusions. She referred me to a major cancer hospital in Toronto, about 60 kilometers away. The hospital, Princess Margaret Hospital, has a reputation of being one of the top cancer hospitals in the world. My first appointment was early in September 2007. I was referred to this hospital in hopes of being fit into a clinical trial for new treatments for MDS. After another bone marrow procedure and several visits, it was determined that I did not meet the criteria for any of the drug trials. In December 2007, she wanted to try me on a drug called cyclosporin, which is autoimmune suppressant. After reading all the literature on this drug, I determined it was not for me. Big mistake on my part. My wife and I got to know the doctor very well. Seeing her every 2 weeks for 3 months, we developed an admiration and a deep respect for her. When she said it was the best treatment for me at that time and that we needed to consider it, our yes came very quickly. The results were very positive. At one point of my appointments, the doctor and Janet, she's my wife, said a phlebotomy in unison. If you know what a phlebotomy is, it is to remove blood from your system. I had a total of 3, which brought my iron overload out of the critical area. Today, I'm still on cyclosporin, and it's holding my hemoglobin in the range of 105. We can't increase the dosage because it has affected my kidney function. How is my quality of life? To sum it up, for the most part, there has been little change. Some days are worse than others. An example is walking a kilometer one day without stopping, and having others days where I stop every 5 meters for a rest. Lifting is also a chore. Housework exhausts me. Sometimes my excuse works, but not too often. As Janet knows, it is a poor excuse to avoid it. We still travel. In 2010, we went to Scotland for a holiday in conjunction with the MDS Foundation International Symposium. Janet and I spoke at the MDS Forum for patients and their caregivers from all the European countries. We travel across Canada to the West Coast yearly. I still play golf with the use of a power cart. The golf club puts a flag in my cart to allow me to take it to as close to the ball as possible, excluding the greens. What are my fears? I'm apprehensive about my life with MDS. I don't dwell on it, and for the most part have little fear. The only time I get edgy is after blood tests, while I'm waiting for the results. Early in my diagnosis, I enrolled in the Leukemia Lymphoma Society First Connection program until about a year ago. The Lymphoma Leukemia Society contacted me to ask if I would talk to somebody that had recently been diagnosed with MDS and had wanted to talk to somebody that has it. My name is in a data bank, and I would be asked if I would contact a person regarding MDS. 95% of the folks were from the U.S. I think my sense of helping someone else took away my anxieties. I've seen a major change in the past year and a half. MDS is no longer in the closet, so to speak. A significant example, of course, is Robin Roberts. She was an anchor for ABC, Good Morning America. Robin went public on her show, and many stories about MDS were in newspapers across the country. ABC continues with updates. What are my hopes for the future? I'm not sure how a 76-year-old man should feel. Quality of life and the longevity of life is my biggest hope, and would be satisfied with status quo. I do hope in my lifetime I see research that would treat and maintain MDS of all types.